Hi there, my name is Weir. I've been a nurse for 44 years, but I've spent 40 of those in ostomy and wound care, so that's pretty much all I've ever done. I spent most of my career in Orlando, Florida, and then in 2017 moved to the state of New York, and in 2019 we moved over to Saratoga Springs, New York, to open a brand new practice. So we are now at the Saratoga Hospital Center for Wound Healing and Hyperbaric Medicine. What came out about late March, early April is that there were some hospitals that had actually closed their wound care centers down as non-essential services. Thankfully, that didn't happen to us. And to me, in a larger sense, it would seem like that would be obviously not to do, because where are the wound care patients going to go if they get into trouble? And that's into the emergency department, which is where they didn't want them. We had a short slowdown in our wound care center. We had been on a pretty good clip because we were a brand new service with this hospital. And so we saw just a couple of weeks where there was a little bit of a slowdown in new referrals, but that has definitely picked back up again. As far as the changes in our interactions with our patient now, absolutely that has changed. And I think it had to change for most people. At the very bottom line, we all started wearing masks as we provided the care. The other thing is that we had to stop our patient visitors from coming in with the patients unless the patient was cognitively not able to answer questions, scared to death, or they were not able to give us good healthcare information. So it was very difficult transition for our patients' families who of course are worried about the wound and want to hear what we have to say. So we had to rearrange how we practice, and our providers actually go out to the cars to talk to the spouse or the child, the person who's bringing the person in. And so that, I think that's been adequate for the families. It was a very tough transition. We screen everyone, even to this day, and anyone who had any change in their general health feeling, we have had them stay home. And so, like many people, we have turned to doing a lot. We did a lot more at the beginning, or like late March, early April, of televisits, video visits. Patients who had our patient portal, we were able to send them information. They could send us pictures, and that was tough. Patients, wound care is so visual that it's hard to really look and see that. But even that, we became adjusted to it. But I would say now we're pretty much back up to almost full tilt in seeing most of our patients. Early on, we actually had some difficulties getting home care to see the patient. I think part of it was because we're in the state of New York, and they were really preparing for a surge that really never came specifically, I don't believe. And so we were able to get home care for some of our patients. We were doing multi-layer wraps. A lot of them continued to come in to see us 2 or 3 times a week. And I think that was a little unusual for a lot of wound care providers, but that is how it seemed to fall out here in our area. As far as the 3M products or services that have been most helpful and useful for me during this time, really has been my old standbys. Whenever we could, we have used the ActiVac therapy system that we use for our ambulatory patients, and that has worked well. We have either had home care, continuing to change them. It really depended on the condition of the patient. Some of them have opted to come in to see us and have us change it. So it really it had a lot to do with the degree of difficulty sometimes of the application and the change of the foam itself. We like to transition. I'm a really big fan of the SNAP therapy system. And so we transitioned quite a few people as soon as we could, because we were then able to get them down to a twice a week dressing change. And of course, patients just love it when they lose the powered machine and can go to the more disposable. So that has really helped a great deal also during this time. It's enabled us to be able to reduce the number of visits for those patients coming in. Other than that, we still have been actively ordering products into the patient's home. So we are able to use a lot of the 3M products that way. And then, like many wound centers, our biggest number of patients are venous leg ulcer. And so we may start with a 3 or 4 layer wrap, depending on the patient's drainage and the shape of their leg. And as soon as we get the edema down, we almost 100% of our patients go into the 3M Coban 2-layer wrap. Patients like it so much better. It's more comfortable, lower resting pressures, fits into their shoe better. So we've had we use a significant number of those wraps. So again, no drop in my usage. And then of course, 3M has so many products that make our job easier and makes patients' lives easier also. In ordering it, we had just opened. And so we weren't set up on KCI Express. We were still filling out paper forms. And I have to tell you, Chris, our local 3M rep for negative pressure has been a godsend on that, because she helped us over a few humps with the paperwork and letting us know where we were in the ordering process. So we've used her a great deal. Even though she can't come in to see us, she has helped us virtually on the phone and helping us out a lot with that. That has a broader answer for me, because I'm an educator. Everything is virtual. Our big meetings are virtual. I've done many webcasts now, because our whole delivery of education has changed. And so we're a small staff right now, but we're getting ready to gear up. And if we are unable to have the representatives come in yet, then we will be utilizing and servicing, I'm sure, virtually. Right now we haven't had to, but I can see us utilizing this to do more in servicing as the whole pandemic winds down and we are able to get out more. I think we're going to see a lot more virtual education done. I believe it's really reinforcing a lot of what we've been teaching all along, and that is don't waste time, good wound bed preparation. From the standpoint of wound centers, my advice would be just that. To get the maximum out of each visit, even if they're a little longer visit. Don't degrade a little bit and say, well, I'll do more next week. We're still fighting the same demons that we were fighting even before the pandemic. We're fighting bacteria and potential bacterial biofilms, necrotic tissue, all those things still have to be addressed. And I believe we really need to maximize our visits and get as much of that wound bed preparation done in each visit that we can. Being better communicators with our patients, making sure we answer their questions, being very open in terms of them calling in with questions, their family calling in with questions, since they're not there in the room. Also moving people on to advanced products as quickly as possible as we get them prepared. And not delay that, thinking, well, I'll try this one more dressing, using things that will speed up or certainly enhance the closure, especially like negative pressure, sooner rather than later. Well, I think that remains to be seen. I think a lot of the things that I've already talked about in terms of our visit frequency and how we deal with home care and our virtual education. I think we're going to see a lot of that. I don't. I used to think that, oh, as soon as this is over, we're going to go back just to the way it was, and I'm not so sure anymore. Some of the things that we have seen change And some of the things that I've mentioned today, I think we'll see perpetuated or maybe even fine tuned. Maybe we'll do even better telehealth. Maybe we'll learn to accomplish more in our business. I think this if anything good is going to come out of this, it will be to practice better, communicate better, educate better, and all of that's always going to benefit our colleagues, our own professional growth, as well as the care that we give to our patients.